Hi, it's Mary, a traditional Chinese medicine tutor and an acupuncturist in Canada.
This video will discuss how to needle Chengshan BL57 according to the syndrome differentiation.
We know muscles in the human body has different layers, superficial layer and the profound layers, which makes the meridians has different layers as well.
Here is an example of the different layers of meridians at the level of Chengshan BL57. On the exterior surface, the acupoint of Chengshan BL57 is just an entrance into an interior world. Depending on the depth of needling, the needle can go through level 1, skin, level 2, gastrocnemius muscle, level 3, soleus muscle, level 4, flexor hallucis longus muscle, level 5, artery, vein, and nerve of the tibialis posterior muscle, level 6, tibialis posterior muscle. Usually, the spaces between the muscle groups are more extensive than the spaces between the muscle fibers within a muscle. Check the cross-section of a pig leg. The muscle layers and the spaces between groups of muscles are easy to locate.
Here is the illustrations of multiple layers of the meridians of our body. Relatively speaking, the skin and the muscles are in the superficial layers. Tendons, vessels, and bones are in the deeper layers. Acupoints are located on the meridians. Therefore, acupoints are also located in between the muscles, tendons, vessels, and bones, and have depths. How deep the needle should be inserted depends on syndrome differentiation. Generally speaking, with an acute exterior problems and in spring and the summer, the depth of needling is relatively shallow, and with chronic and internal diseases and in fall and winter, the depth of needling should be relatively deeper. Furthermore, to treat a skin problem, the needle should be inserted shallowly. To treat muscle-related problems, the needle should be inserted in between the muscles underneath the point. To treat a tendon-related problem, the needle should be inserted close to the tendon underneath the acupoint. To treat a blood-related problems, the needle should be inserted deep until to the side of the vessels underneath the acupoint. To treat a bone-related problems, the needle should be inserted deep all the way until reaches the bone.
Here is an example of needling Chengshan BL57. BL57 is one of the Ma Dan Yang's 11 heavenly star points and is frequently used clinically. Chengshan BL57 is located in the depression formed between the two origins of the gastrocnemius muscle bellies. This is one of the biggest acupoints of all. The feeling of this point under the finger is quite like a funnel. Depending on the disease you treat, the depths of needling Chengshan BL57 are different. Scenario 1. Suppose a patient has heel pain and cannot stand for long. This problem relates to the kidney, and the needle should be inserted deep, close to the bone. Scenario 2. Suppose a patient suffers a bleeding hemorrhoid. This problem is related to blood, and the needle should be inserted deep, close to the vessel. Scenario 3. Suppose a patient has pain and spasms of the cuff. This problem is related to the tendon, and the needle should be inserted close to the tendon or fascia. The deeper the cramp or tightness happens, the deeper layer of fascia should be selected. Remember, fascia belongs to the concept of tendons.
If you find this video useful, please give me a like, subscribe to it, and share it with others. See you in my next video. All the best!